Welcome to Caldwell Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Kimberly Setzer with AMOREM. Welcome, Kimberly.
Thank you for having me.
And more specifically, you are with the grief counseling portion of AMOREM.
Correct. I'm the Director of Grief Services.
So tell us a little bit about your role.
Okay. So our Grief Services department, we follow families who've had the death of a loved one in our palliative care or hospice program. And then we also have a community bereavement program within our grief support services. So we provide grief support, education, counseling, support groups to community members who've had a death of a close family member, loved one that was not a hospice or palliative care patient.
So basically, anyone grieving in our community
Absolutely
can reach out to you.
Absolutely.
And that is an awesome service. But today you're here to talk about something specific. The Hospice Foundation of America's Living with Grief series. I had to cheat and look at her paper. I knew it had a name. Tell us about that.
Okay, so it is an annual event that the Hospice Foundation of America hosts. It's a teleconference, and so it's a panel of experts in the field of death and dying or grief and loss. The topics vary from year to year, and so this year they're going to be talking about the prolonged grief disorder, and so AMOREM partners with them to provide this continuing education opportunity really to anybody in our community, but this year it's geared more towards professionals.
Tell us what prolonged grief disorder is, just in very general terms.
Okay, so prolonged grief disorder is a new diagnosis in the DSM, which is used by therapists, social workers, psychiatrists to give mental health disorder diagnoses. And it is just a new diagnosis. There's a new criteria that you have to meet for that. But essentially it's a diagnosis or a billing code, so to speak, for grief or insurance reimbursement.
So basically, we talked about this a little before we started. Grief doesn't have a timeline.
Exactly.
So for someone who's grieving that first year, let's talk about that. What you deal with, we talk to a lot of folks who are grieving. So what do people in that first year, what do they deal with?
They deal with a lot of things, and so we are very familiar as a society with Elizabeth Kubler-Ross's stages of grief. And so we go through those stages of grief, and a lot of that does occur in the first year, but there is no perfect timeline to grief. And so people move through those stages of grief at their own pace. Another researcher that we really pull on a lot is called Worden. And what Worden says is that you're actually working on 4 tasks at the same time. And so the stages inadvertently might lead one to believe that I'm going to be here and then transition to here and then transition to here, and that's just not realistic in grief. And so it's more back and forth or doing several of those stages at the same time. Worden says we're working on task of healing or mourning. And so we honestly, from our perspective, we combine a lot of that information just to try to help people. So a lot of what people are dealing with is trying to accept that the loss has occurred, that element of shock or denial. A lot of people think that denial means I don't believe that it occurred, and that's not always how we see denial present in grief. It's that I'm shocked or I'm overwhelmed, or it's still really hard for me to grasp the reality that this is true. And so what we see is people start to move through those tasks or those stages of loss and grief and mourning. We see them try to adjust to a new world without their loved one or without their close friend. We see them try to work through maybe some tasks or business that needs to occur, like estates or wills or legal matters, and they're doing that all at the same time. And so what we observe is that people that are grieving are just very overwhelmed. There's a lot going on. There's a lot going on emotionally. There's a lot of tasks to attend to. And so when you put all that together, honestly, what people are trying to do is just survive. They're just trying to keep things going. And so what we do at AMOREM, and specifically in grief support, is we accompany people for that journey and try to help them figure out what that journey looks like for them as an individual, what does need to happen. Sometimes we literally sit with people and help them prioritize this, and this have to be done from a legal perspective or an estate perspective. But how are you also facilitating your grief? Mm-hmm. So what we know is that people grieve in response to a loss. It doesn't even have to be a death. It can just be a significant change in life. but that doesn't mean that you're healing. And so what our goal is to help people heal. And one way that we can do that is to offer support to them, to offer education about grief and loss to them, help them be able to determine, is this a natural response to loss? Is this normal for grief? And we use that term very loosely because that's hard to define. But is it what we would expect to happen? So there are certain things that we know we would expect. We would expect you to have periods of depression. We would expect for you to maybe have difficulty sleeping. We know that grievers don't always eat well. And so we have measurements in place, like a certain amount of weight loss or weight gain, that we say, well, a little bit is normal, but if you've had a significant change, we're concerned about that. So what we help people do is identify, what does their grief look like? How can we support them as they move through their grief and find healing? But then also, what is realistic to expect? So a lot of people call us right after that kind of shock or numbness wear off, and they start to experience the reality of this, and that it's permanent, that this person's not coming back, which can be really hard to accept. And they start to experience the pain and the overwhelmingness of grief and loss. And that's typically when folks call us or they reach out to us for help.
And that's important. While we're here talking about this, tell people how they can reach out to you for help.
Okay, so there's a lot of ways, of course, that you can reach us. You can always call us, and that's at our AMOREM office. That number is 828-754-0101. We also are online at amoremsupport.org. We're on Facebook, Instagram, social media, so there's a lot of avenues to reach us.
And this webinar, teleconference, I'm not even sure what word you used. Anyway, this event is for the people who are the helpers of grief.
Right, so it's for professionals, so nurses, social workers, counselors, physicians, anybody can attend, but it's geared specifically on providing education about prolonged grief disorder, looking at the pros and cons of that, looking at how that's different than what we would consider to be typical grief, but also what are some useful ways to support people that are coping with that. And there are continuing education credits for professionals that need those as well.
And these continuing education credits are free.
Yep. AMOREM is covering the cost for those, and it is 2.5 hours of continuing education credit.
Which, for folks that need those, they know how important that is.
Absolutely.
And as you were talking, I was thinking of one other group who may not need continuing education credits, but this may benefit, would be the ministers in our community, the
Absolutely.
pastors, just big picture grief.
Absolutely.
What else do we need to talk about this event?
I think one important thing to remember about this event specifically is that it is a teleconference, so it's a conversation, and so you're going to hear a lot of different perspectives, and they're really going to have some good conversation about the pros and cons, different perspectives on it, different interventions that are helpful. There's actually several case studies that are part of the presentation, and so it's not just education. There's a lot of conversation in that, and the panelists are very knowledgeable. They're experts in their field. And so I think you would gain a lot of really valuable information, even if you're not a professional that needs those credits. If you are just somebody who often comes alongside of grievers and are there to support people that are in the grief process.
When is the event?
So you can register for the event now. Mm-hmm. It is available, and it will be available for 1 year through April 15th of 2025, and it is a pre-recorded teleconference. So you would go ahead and register now, but you can view it at your leisure or at a good time for you. You would contact Lisa Cavanis to register for that at our AMOREM office, and then she will send you a link and login information for not only the teleconference, but also how to obtain those continuing education credits.
So really it's a self-guided study, so to speak.
Absolutely.
Awesome. Anything else we need to talk about this event?
I don't think anything specific to this event. I just would encourage you, if you have an interest in it, even just as a griever, if you're not a professional, it's good information as you learn more about grief. The more we learn about grief, the better able we are to navigate it. So I think that's it for this event specifically.
All right. Anything else we need to know about?
One thing you do need to know about is that we are going to have Grief Camp coming up. We're going to do something a little different this year, and we'll be back to talk about that, but we're going to have summer Grief Camp. And so we're going to do one Thursday of the month in each of our service areas, and so you will start to see publicity about that as well.
And I'm just going to give my little testimony about Grief Camp. During my days of working at hospice, it was one of my absolute favorite events to see how children came together who did not know each other, but they had that common element of grief, and they bonded and they grew, and you watch parents or guardians react to that, and it was just a really beautiful thing. So if your child is grieving, Grief Camp.
Absolutely. Much needed service in our community, but it is really amazing to be able to see how naturally people are able to support each other through grief, even children.
Especially children. It just, I really have trouble putting into words what it was like being there. Just for a couple of years to experience that, but it really, really is a great thing, a great service that hospice offers.
Absolutely.
So I'm looking forward to talking about Grief Camp.
Me too.
Thank you for being here, Kimberly.
Thank you.
And thank you for watching Caldwell County Today.